problems with incontinence or holding your bowels, controlling them? No, and so no with that. And how many times do you pee or void during the day? 5. Is that normal for you? Yeah. All right. And what color is your urine usually? Yellow. Is it usually clear, cloudy?
It's clear.
Clear. All right. And do you have any burning, your urgency? No, and any incontinence or any trouble controlling your urine? No? All right. Excuse me. All right, we're going to move down to your legs. So you would still be lying down on the bed. Oh, no, don't. This is hard. But so. Okay, so what I'm going to have you do for your range of motions for your legs is I just want you to straighten your leg at the knee and pull your knee to your chest. So just up and then straighten it. And same for the other leg. So bend it up to your chest, straighten it. And that shows flexion and extension of the hip and knee. And then if I could have you for your feet, point your toes. And then raise your toes up. Okay, good job. So then what I'm going to do is I'm going to push against your legs and I want you to push up against me. So go ahead. Good strength. 5. Now what I'm going to do is I want you to push against my hand with your knee. Okay, good. Now push against. Okay. Same with this one, push against. Okay, and pull. Good job. And for your toes, push against my toe.
Actually, I have to touch my dirty shoes.
And push, push. Okay. Lower extremity strength is 5 out of 5. And you have a full active range of motion. So FARON. And well, we're going to have to pretend with your feet because you can leave your shoes on. So then you would be laying down, and what I would have you do is lift up your leg, and I would support it, and I would be pushing on your calf, pushing up, and I would take your foot and dorsiflex it and say, do you feel any pain in your calf? Of course, before this, I would ask you if you are currently having any pain in your calf or not. No? Okay, so Hohmann's sign is negative. Other side? Any pain? No? Okay. So negative Hohmann's sign. And, well, okay, you don't have shoes on. So then feet are cool and even colored and dry. Pedal pulses are equal and +2. And Babinski reflex. Just have you start at the bottom, go up over. What'd your feet do? Tell me what your feet did.
Curled my toes.
Curled your toes. Okay. That's negative. What do you actually want to do? Yeah.
I'm curling my toes in anticipation because it tickles.
Okay, so negative Babinski.
I hate the Babinski sign, man. My foot's gonna itch all day now.
Okay.
I felt sensation.
Oh, thank you. Miss Johnson, how did she want? She wanted. So you felt hard sensation, so I'm going to touch lightly on your legs. Do you feel both my fingers on both your feet?
I can see both your fingers on my feet.
My efforts say yes. You have no shoes on. Okay. Can you feel this?
Just want to close my eyes.
Does it feel? Yes. Don't look at what I'm doing. Can you feel? Does it feel even?
Yes, it feels even.
Okay, so you want to touch in the same spot on both legs in the same pressure and ask if they feel ask if it's even and if they feel it. And you have no pre-tibial edema. Nope. All right, and then I'm gonna listen to. I'm gonna move to your back. So I'm gonna listen to your lung sounds again. So like before, if you get lightheaded, just let me know. So take a deep breath. Good job. Into the mouth, out the mouth. Deep breath. Again. Again. And then you just repeat down on the inside of the scapula. Just make sure you're even and you don't do these. So equal going down.
How many?
She didn't really care how many you wanted, just as long as she saw that you.
In the book, it's like 10.
Yeah, it's like 9 or 10 or something. But she, for the sake of the exam, she just wanted to see that you did equal placement, like this, and that you weren't putting it like over here or something. Just the general area, and don't put it over the scapula. All right. So your spinal alignment is straight. Posture was erect. Now it is. Okay, so what I'm going to do is I'm just going to put my hand over your back, and I'm going to thump it, and I just want you to tell me if you have any tenderness when I do it. Do you feel any tenderness?
No.
No? Other side?
No.
No tenderness? No? Okay, so no
Why
CVA
would you do
tenderness.
a test like that, I wonder?
Don't be asking questions like that.
Oh, but Miss Johnson will ask questions like that. And then
It's to see if your kidneys are having any enlarged. Or having any difficulty. It's checking for kidney pain. Inflammation. Thank you. And you have no sacral redness and no sacral edema. Nope. And your thought process is clear because you've been very helpful this whole time with nice, good answers. And your anxiety level would be mild, less so than mine because I'm taking the exam. And then, so are there any questions you would like to ask me or anything you'd like to mention before we are done? No? Sorry, stop. Okay, so, well, you were sitting up, so would you like to be put in a different position?
No, I'm good.
You're good?
Yeah.
Okay, then we'll leave you here, and then I'm going to put the bed height down and make sure your call light is within reach. Side rails are up if they are necessary, which for you, I think they are.